Good morning, Facebook friends. Helen Archontou here, CEO of the YWCA of Northern New Jersey. Happy Wednesday. I always have to think about what day it is when I say that because sometimes I get it wrong. Happy Wednesday. So happy to have some time with you today on YWTV. As you know, YWTV is all about educating and inspiring you and sharing important information. And today we have another great conversation with you about a very important conversation. And I'm so grateful to have our guest today, Commissioner Germaine Ortiz, to talk with us. We are focused today about the COVID-19 vaccine and the mistrust and challenges that we hear about and are existing in a lot of our BIPOC communities. The pandemic has definitely created so many hardships and anxiety in our BIPOC communities. And specifically today, we're going to talk a little bit about the Latinx families and community where language barriers and limited access to healthcare and information can prohibit them from education and even how to register and get the vaccine, even if they did want to get it. So from there, we know that there's a lot of misinformation that's also been pushed out around the vaccine and the safety of it, as well as overall historic mistrust around healthcare. So, these can be really a lot of challenges in terms of embracing getting the vaccine, and especially difficult for someone who is not here with English as being their primary language, and English is your second language. This is a lot to process, manage, and help make safe decisions for yourself and your families. And so with that, we're so grateful to have Bergen County Commissioner Germaine Ortiz with us to share some of the challenges around the vaccine for the Latinx community and for our BIPOC communities, and what leaders like the commissioner are doing about it. And I have to just thank her so much for joining us. I happened to see that she was out in the community doing this work, and I reached out and asked her to be part of today's broadcast. Before we jump in, I want to tell you a little bit about the commissioner in case you don't know. She has been on the Bergen County Board of County Commissioners since 2016. She moved to Palisades Park, where she ran and won a seat on the Board of Education in 1999. And then after that 2-year term expired, she was elected to the council from 2001 to 2004. She also served on the Bergen County Utilities Authority Commission from 2002 to 2004, and was a board of trustees for Bergen Community College from 2004 to 2012, and then 2015 and 2016. In 2020, she became the chairwoman of the Bergen County Complete County Committee, which helped facilitate and allocate resources for the 2020 census. She was everywhere. She was a machine during the census, for sure. And she has always made a people's first approach in all of her governing, and she continues this tradition now as she has been on the Board of Commissioners. Welcome, Commissioner Ortiz. Thank you so much for taking some time to join us today.
Thank you, Helen. Thank you for inviting me today to talk about this important issue that has definitely affected so many communities throughout, not only in New Jersey or Bergen County, but throughout the country.
So, and this is such a challenging, a challenging one for so many people. I mean, daily we're watching and getting, blips on our phone about the vaccination rates. We're starting to see different numbers. A few months ago, we were hearing about how many people were hospitalized and the numbers with COVID. Now we're watching different numbers, and we're hearing more about the numbers of how many people are getting vaccinated. And we know that the vaccination is the path, to, normalcy, or more normalcy than, where we are, for sure. So it's definitely something that we're trying to get people to feel comfortable with. So with that, could we start by talking about the numbers across the state and what we have here going on and the numbers reflected here in Bergen County? Because I know that Bergen County is doing a great job overall. And I just want to call that out and shout out to our county executive and all of our commissioners and our leadership, because it's amazing when you look at the numbers.
Yeah, Bergen County as a whole has done an incredible job just throughout the whole pandemic, from just from the food task force to helping all our businesses to now vaccination, testing. We're constantly testing at Bergen Community College. We just really want to keep our county, obviously, as safe as possible. And we try to do it by having as easy access to everyone, as in drive-through testing, which we've been, like I said, at Bergen Community College, we've been doing it. We would do it all week. Now there's not as much demand, so now we do it 3 times a week. We also have Bergen Newbridge Medical Center, where we can also be tested by appointment. Not only can you be by appointment, but you could also be vaccinated there as well. So that's really, we manage, as you know, Newbridge Medical is owned and managed by Bergen County. Mm-hmm. So it's a great way for us to be able to access the vaccines. And we've been able to vaccinate between 800 to 1,000 people when at its height, when we were obviously short of supply, but high in demand. But it was very well executed. They did an incredible job. And kudos to Debbie Visconti, who is the president of the hospital, who's done an incredible job definitely on the outreach. And as a matter of fact, this all started when I spoke to her early on, when I myself got COVID in late February, and unfortunately I was 8 days in the hospital. I had double pneumonia. I was in really bad shape. Scary. I was very scared, and you feel so isolated. You're there by yourself in ICU, and I'm very thankful that by the time I got it, there was an actual treatment. I got remdesivir. I got the plasma treatment. I had all sorts of medications. I mean, I was there for 8 days. And as I sat there, I'm like, I can't expect, I mean, I wouldn't want anyone to go through what I'm going through. So in my head, I'm like, and especially because the doctors were telling me that there's a high Latino population in the ICU. I didn't realize that. I think it was like 40% when I was there. I was one of that. And why? We don't have the research yet. Unfortunately, it's only been a little over a year. We don't have the research. But all we can do right now is really try to educate the Latinos to please get your vaccination. I mean, they're in the front lines. They're always, I mean, they've been in the front lines from the beginning of the pandemic, not only through healthcare workers, but their aides at nursing homes that were really affected. Overall, the retail, food, any service industry, I just feel that they're in the front lines and they really need to be vaccinated. Bergen County as a whole we're 1 million residents. We're the largest county in New Jersey, and we have administered about 850,000 doses, of which the 484 were the first dose, and then we're close to 400,000 that are completely vaccinated with both doses 2 weeks on. So that's definitely a great accomplishment for the county that they've been able to do that. I feel like now it's been a little bit more flattened out. So I feel like now we really have to reach out to those different groups that I feel they're not getting vaccinated. Latinos as a whole in Bergen County have only been vaccinated by 11%. But that could be skewed. There's a lot of fear of deportation, especially for those undocumented. But we don't ask if you're we don't ask for any of that information. All we ask is that you live in the county or work in the county, and your name and just basic information, just so you get vaccinated. So there's no reason to fear. And I think there's also skewed because people, they don't want to put their ethnicity. That's some of the questions, because we personally, myself and my aide wrote and have been registering a lot of the people that want to be registered, because 1, you have the language barrier, and 2, a lot of them don't have the technology. And even if they have the technology, even for someone that speaks English, I don't know it's not easy to register.
No, it is not. It's very challenging. And, you touched on so many things in what you just said. I mean, the reality of it is, at one point it was just hard to even get a vaccine, and there was this initial rush and push, for people to go. And so, we've kind of gotten over that hurdle. Now it's accessible. And I also just want to also give a shout out to Bergen Newbridge Medical Center, Debbie Visconti and her whole entire team. I happened to get my vaccine there, and I couldn't have been more impressed with how easy the process they made it, from registration all the way through to doing the vaccine. I felt very safe, even just suddenly being around a lot of people, which was different, just that, and that the whole thing was, a very efficient, quick in and out process. So if that is anyone's fear, there's not only do we have Bergen Newbridge Medical Center, but we have a number of great opportunities across the county, larger scale and smaller scale places to be able to get the vaccine. And for our viewers, we do have a link that we've dropped in here that Commissioner Ortiz had shared with us called bergencovidvaccine.com. And there's a lot, and it's from the county website. There's a lot of great information there about where to access vaccines and answer some of the frequently asked questions, and help, and phone numbers to help you navigate, if you are experiencing some challenges. So, you mentioned obviously our Latino community in particular. I mean, that so many of our Latino community are on the front lines. They are healthcare workers. They are our essential employees all across, the board. And yet, that there still are so much hesitancy.
I just think there's a lot of skepticism for various reasons. Like I had mentioned before, you have the language barrier, the deportation, and I think there's also a lot of mistrust amongst the government, especially with Latin countries, where they've been used for experiments for the past, I don't know how many years. And there's a lot of mistrust in most Latin American countries with government as a whole. I mean, I was just looking at some situations just starting in Latin America right here in Guatemala, where they use syphilis experiments, and right after the war, because we knew in the United States, after our soldiers came back from the war, there was a high STD amongst all the soldiers. So they started just giving syphilis to all these, unfortunately, to these Guatemalans that were not aware, just to be tested.
Right.
And how many died? Thousands. It's very sad. Or in Argentina, where they had a lot of experiments for babies with pneumonia. How many babies died during that experiment? So I just feel like I understand their mistrust, and they don't really have a full, I guess they're not as educated what the FDA is in this country and how important it is, and how it's like how important their health is for us, and for all. I mean, we're doing this so that way they're healthy, our neighbors are healthy, their loved ones are healthy. And Latinos, we're big families. We're very warm, caring, huggy-dovey, and that's not going to stop. I know we try to avoid the 6 feet. That just doesn't, for our culture, that doesn't exist. That's very cold. That's like, you don't do that. And you got to take care. We live with our grandparents. I mean, we live with a lot of our elderly, and a lot of these kids, they're going to school and they don't, they bring it home to their loved ones, and it's something that we really got to address. So what I started doing, because of all this mistrust, I started going to the faith leaders. I'm like, if anybody's going to trust anyone, it's going to be their faith leaders. Mm-hmm. And in here in Bergen County, we have so many small Latin churches, from Catholic to Pentecostal to Christian. I mean, I've gone to all of them. Not all of them, but I'm slowly working my way through them. And what we've been doing is I reach out to them and I said, please, and I speak to the pastor or the religious leader. I said, can you please talk to your congregation? I usually go. Some let me speak. Some I prefer that they speak, because they're not going to, I'm just someone from the government. They're not going to trust me or believe in what I had to say. So I rather that, that he takes care of that, or he or she. And then from there is when we took over, and we, my aide Ronan, he made a sheet with a QR code where it's easily accepted. They could put it on their cell phone, and it's in Spanish, 5 questions. And then we finish the registering, and then they get their code to go get vaccinated at Newbridge Medical for those that, were getting the Moderna. So we were able to accommodate a lot. I mean, we did quite a few people. The county gave us access to 3 days a week that we were doing it. But now, since it's the demand isn't as high, we're doing walk-ins. Mm-hmm. So we don't need a specific date. It's whenever they feel comfortable, whenever they're able to get off work to be vaccinated. So that's where we stand right now. Now that if we can't go about it that way, we just started going on the road. We're doing mobile vaccination and testing, and we're doing it in a regional type form. And we've been, we really wanted to reach out to the communities where I feel like there's more Latinos, like your Garfields, like your Fairviews, your Englewoods. We're trying to reach out to all those different areas throughout the county because I feel it's, if they can just show up, get vaccinated right there and then walk up, makes it a lot easier, especially if there's transportation issues. Although right now I know they're trying to, I know the government is trying to, or they are in the process of doing something with Uber in which they can get access to go get vaccinated. But I think if we go to them, it just makes it so much easier. It worked well last year when we were testing everyone throughout the county. I think we could do it again, and we can't forget to keep testing as well. It's not just the vaccination. I think we have to continue testing, and I think people have forgotten a little bit about that.
Yes, that, people are still, people who are double vaccinated are still getting the virus because there's other strains. And also it doesn't mean that it stops it from happening. It just means obviously that it, lessens the impact of it. So hopefully their case isn't as severe as yours, ended up being, for sure. So it is really important to still be aware of what the symptoms and the signs are and to reach out to either your healthcare provider or to stop into one of the clinics or opportunities.
Right. Even if it's not a county, you can go to any CVS now. I just did it for my daughter. Drive up. We just drove up to the, and you do it in the car. We had the results the next day.
Yeah.
Since she's in sports, I'm constantly, she's exposed or constantly getting, it's really easy now. And it's very simple to get it done. I just wanted to let you know that this, tomorrow, Thursday, May 13th, we're going to be at Riverside Park at 26 Bogle Drive in Lyndhurst from 1 to 4 for the vaccinations. Monday, May 17th from 1 to 4 at the Garfield Senior Center in Garfield. And on May 19th from 10 to 5, we're going to be all day at the Greek Orthodox Church in Fairview, New Jersey, which is right on Anderson Avenue.
Yep.
So I just want to let anybody know who's watching so they can tell either their friends or families or loved ones to please come, where we welcome you to get vaccinated if you can't make it to Newbridge.
I appreciate you sharing that. And Germaine, if you want to email that list to us, we'll drop it into the comments so people can see it even later because people sometimes watch.
Yeah, that's true. They won't.
Later, but but I'm guessing that list is also available on your Bergen COVID vaccine.
Yes, it is. So I'm going to email it to you. Roden's emailing it to you.
Yes, that's great, and we'll drop it in. I really appreciate too that you shared the piece about a lot of fear about citizenship status and whether or not people want to get the vaccine. I know that when you were, the queen of the census, I know you were everywhere talking census. And that was one of the big fears with people wanting to stand up and be counted with the census that we really had to educate and overcome. The YWCA of Northern New Jersey also had a census grant, and we were, actively.
Yes, you were a partner to us, and I'm thank you so much for all your help, because I couldn't have done it without we had all the nonprofits, we had a lot of the faith leaders, we had all the municipalities, and then it became like a competition between all
everyone to get everyone.
But we did great. We came in at 76%. We were at 72 in 2010.
Well, and again, I think that speaks to the leadership we have in this county, which is also why you see our vaccination numbers being higher in this county than elsewhere in the state too. Again, just, shout out to our county executive and our commissioners that have been, on it and everywhere with these discussions. But I appreciate you sharing that, and just want to reinforce that to anyone listening and anyone connected to, individuals that are hesitant to get a vaccine out of fear of having to produce information like that is not something, as the commissioner has shared, that is not something you will be asked, and that's not an issue. The important factor here is getting vaccinated for your health and for your family's health. And
you don't even have to, if you don't want to say what your ethnicity is, or your culture. Like I was saying before, there's this, it's skewed because you have different Latino groups that don't feel that they fall under any of these, groups under their cultural. For example, like Puerto Ricans, they consider themselves Americans. They're not going to say that they're Latino. Or Mexicans, they consider themselves more indigenous, like they fall more under like native blood.
Mm-hmm.
the Afro-Latinos. They're not white, but they're also not African-American. They're Afro-Latino. So where do they fall? So they don't check a box. So that's why that number is so skewed, because each Latino group is just so different in how they feel like they shouldn't fall under, I guess, a certain category. And I think that makes a big difference as well. And that really affects the numbers. From what we know, we think it's around the 11, 12%. But we need to continue to work on those numbers.
Those numbers up, yeah. And it's again wonderful, as the commissioner just shared, for anyone who might have just joined us, that there are some central in community opportunities that are coming up, very shortly, in Fairview and Garfield and Lyndhurst. Where anyone can just go. And, if you look at the breakdown of the counties, those are, I know Sir Fairview's number was very low percentage of vaccination rates. I know I've been watching, watching the number.
You mentioned the census. It's almost like a mirror image. It's almost like a mirror image, because there's that fear and the mistrust, and they just think the government, and they don't want any part of the census. They don't realize how it really affects them.
Yes, yeah. And it does speak to, there's so much conversation, right now, especially around, diversity, equity, and inclusion, right? I mean, that's been, very, very present, almost daily in some form or fashion. If you flip on the news or scroll down your social media feed, a conversation around that. This is why, right? This is why what we're seeing here, the percentages of the numbers that we're seeing here around the vaccination rate and around the census rate, right? Because obviously we know the census is connected to so much more for communities.
We wouldn't be getting this CARES Act money if it wasn't for the numbers that are coming from the census. This is money that's coming back to our communities, federal funding. And that's why it was so important to us to get those numbers out. And here we are today, pandemic. It couldn't be more important to have those numbers now than to receive the money for the vaccines, to receive it for our small businesses, which we did a big campaign with these. I think we gave out a little over like $56 million to over 7,000 small businesses. And as a matter of fact, when we were working on the census, I realized how many of these Latino communities weren't even aware of all the services and programs and grants that are provided throughout the county for them. They had no access. And again, that probably goes back to the language barrier or just not being educated. So I will continue working, even if it's just vaccine, if it's small businesses, whatever it is, to really, we need that outreach to the Latinos and the minority groups who are just not aware.
It really does speak to, our various BIPOC communities, that we are delivering these messages in languages that people are able to understand, so that they can process the information and embrace the resources. Again, for those of you watching, we've been dropping in additional opportunities, right into the links here. I also want to encourage anyone watching, you can follow Commissioner Ortiz on her Facebook page, on her Instagram feed, and important information like this is available to you by, following her feed and connecting you to these resources that we're talking about. And, I'm going to put you on the spot and ask you, maybe you want to deliver the message in another language to our viewers today, too. So in case anyone watching is not, understanding English, is there something that you would like to say?
Oh, well, sure. Para nuestra comunidad latina, estamos aquí en el condado de Bergen, que estamos ahorita mismo vacunando a todos nuestros residentes. Les urjo, por favor, que puedan llamarme a mí aquí, Germaine Ortiz, al condado, o puede conseguirme en email también, y también pueden ir a la página del condado y ahí pueden también ver toda la información por favor, para que se vacunen, porque es muy importante que nuestras comunidades estén vacunadas para tener un poco de normalidad en nuestras vidas. Por favor, comuníquense conmigo aquí en Bergen County.
Well, gracias. Yes, gracias, Commissioner Ortiz. So grateful again that you could make the time to be with us today. And for those of you watching, again, I just want to remind you, YWTV and this episode is available for you to watch and to share with people in your network, in your community. It's very easy to do that by sharing onto your Facebook page, copying the link, sending it to someone in Messenger, sending it in a text. This is an opportunity for you to be part of helping our community in a very real way by letting people know about the resources and opportunities that Commissioner Ortiz has shared with us today. So please take the opportunity to integrate what you've heard here today somewhere into a conversation that you're having.
It's true. I mean, Bergen County has, 6 hospitals? We probably have the most hospitals in a county. So you have access to all these hospitals as well. So please, we urge you, please get vaccinated. We need to get back to some normalcy, and hopefully this summer we can get back to some normal, I don't know, just a normal summer, because compared to last year, that was really tough, not especially to our children, honestly. I really want our children to get back to some normal and back to school, most importantly.
Yes. Come fall, that's what we definitely want to gear everyone back to, being face to face. And I really do appreciate you sharing your own personal experience with COVID and the challenges that you went through. We're so glad. I'm so glad, that you're doing better and came out the other end of that. We know so many people were not as fortunate. For sure. And
I've lost a lot of friends and family due to COVID, and it's real. It's here. It hasn't gone away. There's strains coming. That's why this vaccination is so important. You're getting all these different strains. It's not going to go away. So
right.
I really
this is part of our lives going forward. So we do need to integrate the different strategies that we now have to be able to manage it. So with that, again, thank you so much, Commissioner Ortiz, for joining us. You are a wealth of amazing information. And I just, again, have to just say so much thanks to you, to all your fellow commissioners, to the county executive for your leadership. I mean, this, I have to say, nonstop since March 2020 to now.
We haven't stopped.
Your cases have been everywhere. I'm
very thankful to have amazing colleagues and a county executive that has really, he's an incredible leader, and we've all worked together, and we're definitely, we're Bergen strong, and we're going to move forward, and we're going to get back to some normalcy, God willing.
Well, and we'll be doing that all together. Bergen strong for sure. And with that, everyone, we want you to have a great day. We also want you to join us for the rest of the week. We have another wonderful episode tomorrow. Those of you who are regulars at YWTV know that on Thursday, we share the mic now with Black women in our community to amplify their voices. And we have another great conversation scheduled at 2 p.m. tomorrow with Jahari Jacobs, the owner of Time After Time. So I'm really looking forward to talking with her, and I hope you can join us. I also do encourage you, yesterday on YWTV, we had a wonderful conversation about stand up against street harassment and the bystander intervention training that we are co-sponsoring with Hollaback. It is next Thursday, May 20th at 3 p.m. for 1 hour. Please, we encourage everyone to schedule that time on your calendar. It's virtual. The link is here in our comments. We want everyone to learn how to be able to stand up safely and interrupt and stop hate, racism, gender violence. There are active ways that you can be part of the solution and save people from what we are watching daily happen on the news and in stories from our communities. So please sign up and join that, and we'll be sending that out. We encourage you to send it out to your networks. We really can have many people on the training, and so we'd like to get to as many people as possible. Also, for any of our job seekers that are out there that have been impacted by this time has impacted their employment, whether you're underemployed or unemployed, our Next Chapter program has a free training opportunity for you on Wednesday, May 19th, called Unconventional Time Management with the Michelle Delgado, who is the founder and CEO of Heart Metrics Consulting and Coaching. And she's going to talk to you about how to organize and manage your time a little bit, especially now when you're job seeking, as well as trying to live during this time. And, with all of that, we want everyone to stay healthy, stay well. And again, thank you so much, Commissioner Ortiz, for being with us.
Be safe.
Same to you. Same to you.
Take care of your family.
You out there. I will. Same. Bye, everyone. Take care.